So I'm a dentist, and one of the most common questions I get from patients is, do I really need a root canal? And I get it. Root canals have a reputation and they can sound painful, expensive, a little intimidating. And what most people don't realize is that a root canal can actually save your tooth, especially if it's done at the right time. And if you wait too long, you might end up with more pain, more expense, and possibly end up losing the tooth altogether. And in this video, I'm going to walk you through the 5 clear signs that could mean you may need a root canal. And I'll try and break them down so you can understand what's happening inside your tooth, why it matters, and when to act. And some of these signs might surprise you, and even one of them can sometimes be misunderstood, even by people who have seen a dentist before. And we'll also talk about the most common symptoms that feel scary but aren't serious, so don't panic when you don't need to. And let's start with the most common and most overlooked warning sign, and that's lingering pain. And this is the kind of pain that doesn't just come and go. It usually sticks around. So let's say you drink something cold, hot, and then you feel pain for about 30 seconds or more. This type of pain is called lingering pain. And it's not a sharp jolt. It's usually a deep, dull ache. And this is the kind of discomfort that you feel when the nerve inside the tooth is inflamed or it's starting to die. When a nerve is inflamed, the pressure inside the tooth increases. And that's what causes persistent pain. So the goal of the root canal is to relieve that pressure. And, this is what you might experience. It could be a constant dull ache in one tooth. It could be pain that gets worse when you lie down, pain that keeps you up at night, or even a tooth that seems to throb. And that generally is confused with sensitivity. Now, don't confuse that with sensitivity. So a sensitive tooth might hurt briefly for a few seconds, especially when you drink something ice cold, but lingering pain is different and is a type of pain that doesn't let go. So what does this mean for you? Now, if you're dealing with ongoing pain, especially if it's localized to one tooth and it can be reproduced with hot and cold, that's a major warning sign. And it doesn't always mean you need the root canal right away, but you do need an evaluation. And if you leave that untreated, the problem might get worse, the inflammation can progress to an infection, and that's when things can get complicated. And another red flag is when painkillers aren't working anymore. So if you're taking over-the-counter medications and the pain seems to fade for a short while or doesn't really go away, that means usually the nerve or the damage inside the nerve is getting worse. People will often wait for the pain to go away on its own, and unfortunately, that's not always a good thing, and more on that later. But before we get there, let's move on to another major clue that could mean that your tooth is in trouble, and that's a pimple on your gum. So you might run your tongue over your gums, you feel a small bump, maybe it looks like a little pimple, you think nothing of it, it disappears, then maybe a few weeks later it comes back, and then this cycle repeats for a few months. You're likely dealing with something known as a gum boil or dental fistula, and it's your body's way of dealing with an infection. And when I see this in a patient, I know that they're likely dealing with an abscess. And here's what's happening. When the pulp or the nerve inside your tooth dies, the bacteria inside the empty space release toxins. And what happens is your body tries to fight this by sending white blood cells and fluid, creating pus. And that pus builds up as pressure, and that needs to go somewhere, and that's what creates a pimple. And even if it's not painful or harmless, the infection is still present, and if that isn't treated properly, that can spread to the jawbone, to neighboring teeth, or in extreme cases, even beyond your mouth. And in some cases, these gum boils can burst, and people say, oh, it drained, it sorted itself out, and, I'm fine now, it's not painful. But the source of infection is essentially still there. It's still in the tooth. And these are the signs I usually look out for. So if there's a bump that comes and goes in the same spot, bad taste or odor in the mouth, pressure when biting, or even swelling or warmth around the area. Again, this doesn't mean pain, and that's actually part of the danger. Just because it doesn't hurt doesn't mean that it's not serious, and the treatment depends on the cause. But if the infection is coming from inside the tooth, the root canal is basically the most predictable way of cleaning the tooth, removing bacteria, and sealing the tooth properly. So what happens if you don't treat it? The infection can still silently spread, affecting your bone levels, weakening nearby teeth, and worst case scenario is it can get into your bloodstream. And next, let's talk about something that doesn't necessarily feel painful, but is very visible, and that's tooth discoloration. Have you ever noticed one of your teeth that looks darker than others, maybe a grayish tone or a blackish shadow? And when a tooth darkens from inside, it's usually a sign that the blood supply has been cut off and the pulp tissue has broken down. And the pigments from the breakdown seep into the dentin, so the dentin is the second layer of the tooth, and that's why the tooth darkens. And this is called pulpal necrosis. It's a clear sign that something has gone wrong deep inside. And this type of discoloration isn't just cosmetic, it's diagnostic. And here's what it can indicate. So it can indicate a dead or dying nerve, a history of infection or inflammation, a hidden fracture or damage to the pulp. And it's usually suspicious also if the tooth feels different. So if there's a slight tenderness when you tap it, pressure sensitivity, or gum swelling above it. And if that's caught early, the tooth can usually be saved with a root canal and something known as an internal bleaching to restore the color. But if that's ignored, the dead tooth can turn into a full-blown infection with swelling, abscesses, and eventually tooth loss. And now let's look at something even more alarming, and that's pain when biting or chewing. So this might be a sharp, stabbing pain when chewing, pain only when releasing your bite, or discomfort with certain foods or pressure. And if a tooth hurts when you bite down, especially if it's isolated to a single spot, you could be dealing with a cracked tooth, you could be dealing with inflammation of the ligament around the tooth, or you could even be dealing with an infection that's pressing against the bone. And in root canal cases, the pulp is inflamed or infected, and the pressure builds up. And when you bite down, what happens is you're compressing the tooth into the socket against the bone, and that's what aggravates the pain from the nerve and ligaments. And that's where the pain basically comes from. And one trick we use in practice is something known as a bite test. So we have you bite down on a stick or a special tool or instrument, and one tooth at a time. And basically, when you get pain when biting down or upon release, that could mean a vertical crack or an infection. And the key here is to not delay it, because if we catch it early, sometimes with a root canal, we can save the crack. But if the crack extends far below the gum line or extends to parts that we cannot restore, then the tooth becomes unrestorable and we might have to lose the tooth. And it's important to note as well, if you've recently had dental work or if you bit down on something hard, mild pain for a few days sometimes can be normal. But if the pain persists or gets worse, then I suggest you get it checked. Now, here's a twist most people don't expect, and that's pain that suddenly disappears. Let's say you had a bad toothache last week and all of a sudden it's gone. And you think, great, it healed. And here's the thing. Now, a dead tooth or a dead nerve, what we basically call a non-vital tooth, can still get infected. And the danger is there's no longer pain to alert us or to basically alert you if there's something wrong or something that's not right. And it can progress silently, towards bone loss, towards an abscess, and worst case, it can even have systemic effects. The infection spreads to other parts of the body. And that's why regular dental checkups matter, because we check for the vitality of the tooth, we take x-rays in order to catch problems early before they cause any real damage. So don't assume no pain equals no problem. Sometimes no pain is actually the biggest problem of all. Now, here's the thing. If you're experiencing any of these signs or symptoms, don't panic, but don't wait either. And root canals are nowadays quick, predictable, virtually painless, and most importantly, they allow you to save the natural tooth. And it's the best option when possible. So if you found this video helpful, I've got another video that you might want to check out, and that's a root canal step by step. Thanks for watching, and I'll see you in the next one.